Today I'm going to be talking about Tourette Syndrome. What is Tourette Syndrome? Tourette Syndrome, or TS, is a neurological condition that involves involuntary muscle movements and uncontrollable vocal sounds. Both are called tics. The word syndrome means a group of symptoms, and tic is a French word for twitch. The early symptoms of TS are almost always noticed first in childhood, with the average onset between the ages of 7 and 10 years old. TS occurs in people from all ethnic groups, and males are affected about 3 to 4 times more than females. It is estimated that 200,000 Americans have the most severe form of TS. Although TS can be a chronic condition with symptoms lasting a lifetime, most people with the condition experience their worst symptoms in their early teens, with improvement occurring in the late teens and continuing into adulthood. What causes Tourette syndrome? Scientists believe a chemical abnormality or abnormal metabolism in the neurotransmitter system of the brain causes TS and other related disorders. Neurotransmitters carry signals from cell to cell in the brain and between the nerves. One theory is that a heightened sensitivity to the brain chemical dopamine causes tics. Genetic researchers are working to identify TS gene or genes and believe they are getting close. Other research points to abnormalities in certain brain regions, such as the basal ganglia, frontal lobes, and cortex. The circuits that interconnect these regions and neurotransmitters, such as dopamine, serotonin, and norepinephrine, are responsible for communication among nerve cells. Given the often complex presentation of TS, the cause of the disorder is likely to be equally complex. What are tics? Well, tics are classified as either simple or complex. Simple motor tics are sudden, brief, repetitive movements that involve a limited number of muscle groups. Some of the more common simple tics include eye blinking and other vision irregularities, facial grimacing, shoulder shrugging, and head or shoulder jerking. Simple vocalizations might include repetitive throat clearing, sniffing, or grunting sounds. Complex tics are distinct, coordinated patterns of movement involving several muscle groups. Complex motor tics might include facial grimacing combined with a head twist and a shoulder shrug. Other complex motor tics may actually appear purposeful, including sniffing or touching objects, hopping, jumping, bending, or twisting. More complex vocal tics include words or phrases. Perhaps the most dramatic and disabling tics include motor movements that result in self-harm, such as punching oneself in the face, or vocal tics including coprolalia, which is uttering swear words, or echolalia, which is repeating the words or phrases of others. Some tics are preceded by an urge or sensation in the affected muscle group, commonly called a premonitory urge. Some with TS will describe a need to complete a tic in a certain way or a certain number of times in order to relieve the urge or decrease the sensation. Tics are often worse with excitement or anxiety and better during calm, focused activities. Certain physical experiences can trigger or worsen tics. For example, tight collars may trigger neck tics, or hearing another person sniff or throat clear may trigger similar sounds. Tics do not go away during sleep, but are often significantly diminished. What are some treatments for TS? Because tic symptoms do not often cause impairment, the majority of people with TS require no medication for tic suppression. However, effective medications are available for those whose symptoms interfere with functioning. Neuroleptics are the most consistently useful medications for tic suppression. A number are available, but some are more effective than others. For example, haloperidol and pimozide are very useful. A mother of a child with TS said, "If a child tics don't get in the way, let him tic. You don't want him medicated unless you have no choice." Unfortunately, there is no one medication that is helpful to all people with TS, nor does any medication completely eliminate symptoms. In addition, all medications have side effects. Most neuroleptic side effects can be managed by initiating treatment slowly and reducing the dose when the side effects occur. Psychotherapy may also be helpful. Although psychological problems do not cause TS, such problems may result from TS. Psychotherapy can help the person with TS better cope with the disorder and treat with the secondary social and emotional problems that sometimes may occur. A recent study indicates that nicotine eases some symptoms of TS. Nicotine is the drug in tobacco that makes smoking addictive. Usually TS is the cause of too much dopamine, so nicotine floods the dopamine receptors enough so they shut down completely. No doctor suggests the TS patient to smoke. Rather, they suggest trying the nicotine patch or nicotine gum. There are also treatments for TS without using any medication at all. Making better food choices, such as eliminating junk food and snacking on fruit instead, improves the quality of a person's diet. Some doctors believe this leads to better balance in the body's neurological system. Research has shown that parents of children with TS have noticed less hyperactivity in the child with foods such as chips, white bread, fried treats, and chocolate were eliminated from the diet. Vitamins and food supplements are also sometimes believed to help maintain TS. Some researchers believe that when the body spins out of whack, as with TS, extra vitamins and food supplements help restore balance and reduce signs of the disorder. Vitamin B6 is a common diet addition for TS and related disorders. This vitamin helps many chemicals in the brain work. No formal studies verify that vitamins actually work, but some families do report success. Physicians in Europe have experimented with surgery to help reduce severe ticking. This surgery involves implanting electrodes in the brain. Then electrical charges are sent into the basal ganglia, site of the excess activity that causes tics. By charging different parts of the basal ganglia, doctors are able to reduce motor and vocal tics. Over time, the charges are repeated until the tics fade. Surgery is only used in extreme cases, as surgery may result in serious risks. How do students with TS function in school? Although students with TS often function well in the regular classroom, ADHD, learning disabilities, obsessive-compulsive symptoms, and frequent tics can greatly interfere with academic performance or social adjustment. After a comprehensive assessment, students should be placed in an educational setting that meets their individual needs. Students may require tutoring, smaller special classes, and in some cases, special schools. All students with TS need a tolerant and compassionate setting that both encourages them to work to their full potential and is flexible enough to accommodate their special needs. This setting may include a private study area, exams outside the regular classroom, or even oral exams while the child's symptoms interfere with his or her ability to write. Unlimited testing reduces stress for students with TS. I'm going to show you a very interesting video.
Tourette syndrome. Well, there it is. Tourette syndrome is a certain brain defect. It's a neurological problem that I was born with that causes you to tic. Ticking, like coughing, twitching, like snapping all the time. Do a lot of things people wouldn't like. My mom calls me the mouse because I make a little squeaking noise. Shaking my head. Now that I said it, I have to do it. I would go like this, flapping my arms, and everybody thought I was trying to, laugh. I'm like, no, you can't help it. It's not contagious. Like if I shook your hand and said, "Hi, my name's Kim," you would not get Tourette. No, they come whole another person. Like me. I'm a regular kid. There's a point in a friendship with someone with Tourette's where they ask, I've always wondered, can you stop it? Can you, just stop? I've had second cousins that don't know much about Tourette syndrome that holds my head like this. And when people do it, I can still tick. I mean, I'm just like that, Holding them back just gives me this feeling of tenseness, like everything's kind of clamped together and all your muscles are contracted. I want to hide my tics and don't let anyone see them. Like, I take my pencil and I hit it on the floor and I kick it. And then I get down on the floor, do the tics that I have to do. Pushing on my stomach a lot. And then, someone says, oh, can you get off the floor? So I say, well, I'm getting my hips off, so I just kick it farther. Today I'm talking to my class about Tourette's. Tourette syndrome is hereditary. About 1 in 1,000 people have it. Boys have it 3 to 4 more times than girls. It's not contagious. I think it's important to tell one person, actually, because as my theory goes, tree of telling, if I tell one person, they'll tell another person, and then that person will tell 2 people, or 4, or 3, or 7, or 8. 1 year later, there might be millions of people just because that one person told so many people. There's no known cure so far, but there is medication that helps it. I want everyone to know, because only 15% probably of the world knows about it. It just really depresses me that no one really knows about it. You can't hold in a sneeze, you can't hold in a cough, maybe, or you can't hold in a yawn forever. It doesn't feel right. That's kind of like when I have a tic, and that's how hard it is to stop. So when you see me annoying, it's not because I want to. It's just more like I just have to. Whoever has tics will be a person still. Not like you're bad or anything. You don't know anything. You're still a human, even though you have Tourette's. I hope that people accept me who I am, and that